Hi Frank, thank you for joining us today. How are you? I'm very well, thank you. And you? I'm doing great, thanks for asking. So today we're here to talk about your experience with the Gatewatcher solution and more broadly, your feedback on cybersecurity issues that you are currently dealing with. But first, could you take a moment to introduce yourself, who you are, and your role? Sure, my name is Franck Baibourdian. I am the new CISO of the Abington Hospital Centre and also the CISO of the hospital group for the Vaucluse department. I say new because the position was created in January 23, so it's been little over a year and a half now since I've been in this newly created role. Okay, thank you for that. And would you mind sharing a bit more in detail of the Abington Hospital Centre of the hospital group? Of course, GHT, the Vaucluse Hospital Group, as it is called, has 10 facilities, and the 11th facility will be in operation from next month. These facilities are spread across the entire Vaucluse department. As of today, the group looks after around 3,000 beds, 6,000 employees across the department. In terms of the information systems, we have roughly 4,000 workstations and 700 servers. Quite an estate to look after then. Indeed, but I'm not alone, luckily. Because each facility actually has its own IT department, which remains independent, with the head of department who is the information system manager at each facility and who is my security correspondent effectively. Each follow their own action plans, implement various recommendations and best practices, and helping meet funding programs and regulatory requirements. As sites and the team follow the action plans we have defined for each, with implementation steps. That sounds really challenging and exciting at the same time. What are your main cybersecurity challenges today? Like any facility, the main challenge is to enable healthcare professionals continued, uninterrupted care and treatment of our patients. The difficulty, indeed, is knowing where to set the security perimeter, as not to constrain them too much in their practices, but at the same time, achieve an acceptable level of security on the various information systems that are increasingly daily and also increasingly open to the city and other entities. Since you took up your position, have you experienced a cyber attack at GHT level? At the GHT group, luckily, no, not yet. Fingers crossed. That's good to hear. In businesses that neighbor GHT, where I worked before, we did have a facility that suffered a cyber attack. Like so many other facilities that are experiencing cyber attacks across the industry. Can you share a bit more? What was very striking was the mutual support, which is essential. All the hospitals in the group provide their help. Many of us participated in terms of manpower and lending equipment to help them restart as quickly as possible to reduce the downtime. And what type of an attack was it? Ransomware. So we found ourselves in the support service, with hundreds of unusable devices and laptops. The entire information system was encrypted, so there was no way to use it again. And that's why we need to be prepared for this type of a situation. Once we have implemented all the types of solutions that can both protect us and detect what we call weak signals to enable us to be vigilant and respond quickly. Because we have to think that this type of a situation, like a ransomware attack, time is the crucial factor. The sooner we can detect an anomaly, the sooner we can respond, investigate, and act to limit the spread. So several layers must be put in place to help. The first one is detection, protection, but also preparing for the worst, like a neighboring business that had to restart from scratch if necessary. And beyond the constraints we already know in cybersecurity in general, what specific constraints do you face as a healthcare facility? Well, let me put a perspective for you. Healthcare facilities is like a small town in a way. There are hundreds and hundreds of different professions. Each of these professions is almost entirely automated, with totally diverse solutions, different security levels, maturity levels of the different vendors, often with remote maintenance for each solution, using different remote accesses. All of this leads to a very complex, highly diverse ecosystem, often vulnerable in certain areas. Like so many others, solutions still use old protocols that are not sufficiently secure because they can't be automated, or we have medical equipment, for example, that dates back many years and of which we cannot intervene because we do not have control. These are package solutions. We have to find ways to secure them nonetheless. So that's one of the major constraints, the diversity and disparity in maturity levels. We also have a lot of regulations like so many other industries. NIS2 is coming at the end of the year. The budgets are not there yet, but things are starting to move with various programs, notably the CARE program. Sounds like a real challenge. We have previous programs like France Relance, which have already helped us a lot. Indeed, things are moving forward, and that is really good for us. We also have a lot of shadow IT, Some solutions that allow us to monitor networking exchanges help us detect all of the shadow IT, which we need to manage. And what was the trigger for your decision to implement an NDR solution? The trigger for me was, I asked myself how to further secure what was already in place. We already had endpoint detection and response solutions, EDRs, in place, like many other facilities. Endpoint detection and response solutions have been installed on each terminal, on each asset over the last couple of years. For me, the NDR solution is really a complement to this, as it provides a more focused view on the equipment. The NDR solution, however, monitors the network traffic that occurs between these devices, which is really important. So for me, it is truly complementary to the EDR solution we have. Although the EDR is still essential today, it is unfortunately no longer sufficient. We see more and more workarounds around the EDR protection we have. Therefore, it is necessary to complement it with the other monitoring solutions. And if we can add protection, that's even better. You mentioned medical equipment or biomedical equipment, for example, which are assets on which you ultimately can't update EDR, right? Exactly. In those cases, you need to double your efforts, multiply barriers in terms of segmentation. The NDR allows us to detect and even cut off switches or network access. You really need to multiply the barriers for the equipment where we don't have much control over. And what were your main success criteria when implementing this solution? The success criteria? Since the NDR solution is running 24/7, 7 days a week, just like the EDR solution, we called upon a managed SOC service. One of the main criteria was indeed the proper integration into the SOC, with a clear definition of the remediation actions that the SOC might be called upon to carry out, and the sharing of the responsibilities between the SOC and the facility. Another objective was also for the operational teams to take ownership of the solution. They need to be able to manage it alongside the SOC. It is essential to connect with it often and not leave it in the corner without revisiting it. We need to familiarize ourselves with it so that if an incident occurs, we can respond quickly without relying solely on the SOC. We should also be able to see what's happening and complement what the SOC might implement. And the last success criteria was the relevance of alerts. If we are overwhelmed with false positives, the solution will be of no interest. So working on the relevance of alerts, minimizing false positives, is a crucial point. Okay, and merely a subjective question. What was the main criteria for choosing the Gatewatcher solution for you and your teams? To be honest, the ease of use, the richness of its data, and we also find it quite easy and straightforward compared to other vendors we evaluated. The configuration element of the solution is perfect for an organization our size and complex environment. Many possible ways of deployment is great. Investigations could be thorough enough because we had a lot of detail about the information provided by the detection capabilities. What we also liked was the Kibana interface with Elasticsearch, which allows many different views. As a CISO, I'm interested in having a macro view, which is easily achievable. But my teams can also deep dive quickly to investigate down to package level. So for my operation teams, this is also a real plus. So the customization option and dashboard with ease of use, right? Yes, indeed. Something that allows you to create your own queries and dashboards without real effort. And what arguments did you use to convince the management? Because we know that implementing new cybersecurity solutions requires justification. It costs money, and you have to explain why. What were the main arguments? Well, I'm lucky to have a good relationship with the CIO and to have his full trust, so I didn't have to do much convincing. But the main argument was indeed to have this tool complement the EDR we had in place, which remained focused on endpoints. With the NDR, we can have a more comprehensive view and investigate further what is happening, not just in case of an incident, but also identify what is being used in terms of obsolete protocols, shadow IT, etc. It's a need that we don't have with other tools. So it is very critical on a day-to-day basis to better secure the various systems. That's why I say we should not leave it aside. We need to make it our own and work with it every day. It's an excellent remediation tool. Yes, it goes a bit beyond pure cybersecurity, integration into a broader ecosystem, right? Exactly. And now the solution has been running for some time. What is your feedback on the implementation of the solution? Everything I highlighted above is great. One pitfall to avoid is, we thought it would be best to monitor all network traffic at once to make sure we could see everything. That was a mistake. You need to implement the progressive ramp-up in monitoring with the solution. So it's about identifying the most critical and vital networks, whether it is the infrastructure or patient data exchange networks. Then gradually add VLANs and networks to monitor. Otherwise, you'll find yourself overwhelmed with alerts and false positives, not knowing where to start, and you'll have to backtrack. We made the mistake of monitoring networks that were directly connected to the internet. On our externally exposed firewalls, we were flooded with IMAP alerts because there were robots on the internet constantly scanning all public IP addresses. So since we can't intervene on the perimeter, we disabled that network because it had no added value for us. Yes, the relevance of the networks to cover and to capture the points to set up, since we can set up different capture points depending on the different areas to monitor. Indeed, if not all network coverage at a single point, we can actually deploy multiple probes at different points in the network and collect all this information at once. Very well, thank you. And beyond the NDR part and more broadly, what recommendations would you have for your counterparts in the health industry? As I just mentioned, deploy progressively. Don't try and do too much at once. Deploy the solution gradually. Work closely with the teams to ensure they see the right alerts, and agree on the scope of intervention at the level of alerts they should escalate to us. Those are the main recommendations. Also, maintain good network hygiene and best practices. And regarding cyber attacks, be well prepared with crisis exercises and don't hesitate to support each other among facilities. Cybersecurity is an entire ecosystem. We shouldn't focus on one single solution, but should have an overall view. And we shouldn't stay alone either. Indeed, having a team, as you say, peers, counterparts, exchanging information. Ultimately, the key is to be ahead of the information and be able to react as quickly and as early as possible. Exactly. It's about detecting what we call weak signals to implement rapid, effective response to limit the spread as much as possible and as quickly as possible. So yes, it's a race against time, and having relevant alert feedback is essential. Very well. Thank you very much for your time, Frank. Thank you, Kevin. And see you soon, Frank. See you too. Have a good day. Have a good day.